Hi, I'm Femi Okay.
I'm Malika Bilal, and you're in the stream.
May is Maternal Depression Awareness Month in the United States, and today we're discussing the myths and stigma associated with postpartum depression in the US and also around the world.
So, what are some of the questions you have? Tweet us or comment in our YouTube chat, and you too could be in the stream.
Everyone I knew, I felt like had the most wonderful experience after they had their baby, but I didn't know how to say, like, I am freaking out.
I believed that every parent around me knew what they were doing and that I was this devastating failure.
Postpartum depression, sometimes referred to as the baby blues, is a mental health condition that some mothers experience shortly after giving birth. Worldwide, around about 13% of women experience it, with a number closer to 20% for mothers in developing countries. This form of depression doesn't just affect biological mothers, though. Adoptive and gay parents can also experience it.
So, where can parents who are dealing with postpartum depression get help, and what should their relatives know? Well, here to talk about this in Campeche, Mexico, Carly Pearson, a lawyer, writer, activist, and mother who has battled with postpartum depression. She's also a member of the Stream community and pitched this show. In Chicago, twin doctors Idris and Jamil Abdurrahman. Both men are board-certified obstetrician gynecologists. Jamil and Idris, who happens to be my brother-in-law, have spent the last 10+ years focusing on postpartum awareness. I'll welcome everyone to the stream. I want to start with a member of our community, another member of our community, because so many people wanted to weigh in on this topic. Carly, Zinnia here on Twitter says, postpartum depression for me was a constant struggle to express. It was an unpopular and uncommon position for a young millennial like me to start a family that early. So not a lot of people my age could understand what I was going through, and the older generation felt I was being ungrateful or misinterpreted my emotional absence as neglect for my newborn. Carly, when you read that story, can you relate to it, knowing what she's feeling? When was that moment when you felt similarly?
I think that's an interesting point. I wonder whether, and the doctors can probably answer this better, but whether there's more prevalence of postpartum depression in younger mothers or older mothers, or whether it's actually kind of irrelevant, the age of the mom. I can relate to people feeling like I was ungrateful. Maybe people who struggled, people who I knew who struggled with getting pregnant, feeling that I was ungrateful for not just being elated at the whole experience. Older people who maybe were uncomfortable with the topic, who also kind of expressed the same thing, like, because I was ungrateful for expressing myself the way I was. And I think just finding the words to talk about it was difficult in and of itself because it's embarrassing. And why is it embarrassing? Because there's a lot of stigma.
Mm-hmm. Doctors, Carly asked you a question right at the beginning there. Older, younger mothers, who gets postpartum depression more?
Well, you know, statistically speaking, they tend to say younger mothers, but I'm going to go out on a limb and say that I think postpartum depression is widely underdiagnosed, okay? So statistically speaking, we're talking younger mothers, but I think more women than not have some degree of postpartum depression or baby blues. One thing I kind of wanted to correct, I guess, I know when the show first started, Femi said baby blues and postpartum depression. Baby blues is a little bit different. Baby blues, almost 90% of moms have. It's just that, you know, you're kind of overwhelmed, you're sad, you're tired. It goes away after a couple of weeks. Whereas postpartum depression tends to kick in around week 2 or week 3, although it can be up to, 3, 6, 12 months after delivery, but it's much longer lasting and more profound.
I'm just looking here. This is from Love Belfast on Twitter. Mums urged to check their maternal mental health. Check your symptoms. The trouble is, you need to know what those symptoms are. So even before you can go to resources to help you, what do you need to be looking out for? What does your partner need to be looking out for? Your family? How would you even know?
Well, I mean, oftentimes the symptoms of postpartum depression will look very similar to the symptoms of depression in general. And so somebody may have what we call hypersomnia, where they are sleeping a lot. Or you can see the opposite, where they're not sleeping enough. Now, that can be a little tricky because when you have a new baby, well, why are you not sleeping? But if you're not sleeping when you can sleep, the baby's sleeping, that can be an issue. You can see changes in appetite. You can see changes in what we call affect, where they just aren't themselves. You look at them and they have that blank stare. These are some of the more common symptoms that you'll see.
And I think one thing that you kind of touched on that is huge, I think when you're in that moment, when you are the person that has postpartum depression, sometimes it's difficult to realize this is what's going on, you know? Families play a huge, huge role, dads in particular, but families in general. Families need to be looking out for kind of the symptoms it's talking about. If you feel like either you or your partner is not bonding well with the baby, that's a huge sign of postpartum depression. And that's one reason why women don't want to talk about it, because they feel bad.
Yeah, I was going to say, that's where a lot of the guilt comes in, because like was being said earlier, a lot of people feel like this is a joyous occasion. Why aren't you happy? And then a lot of people feel like, my God, you've got this beautiful baby. This is a gift. And one of the classic symptoms of postpartum depression is you don't bond with that baby.
Mm-hmm.
And no parent wants to say, I'm not bonding with my baby. They feel like a horrible parent, a horrible person, and they feel like people are going to look at them in a bad way. And unfortunately, they do, because there's so much misunderstanding surrounding the condition. But those are some of the things that you look out for. And just, if you see those signs, you can't be afraid to say anything. I had one patient who went from postpartum depression to postpartum psychosis.
Yes.
And it was her mother who brought her to me and said, she is not well. She said she's not sleeping. She's talking to people who aren't there. She's talking about people who don't exist. And she came to me and said, there's a problem. And I said, bring her in. She brought her in, and we got her help immediately. And so the families play a role, and you can't be afraid to step in. And then when people step in, and it's easier said than done, but moms have to feel comfortable saying, yeah,
Right.
something's not right, and I need some help.
So it's that part about feeling comfortable to know that something is not right and knowing who to go to. I wanted to share this. Maureen Shaw tweeted into us because we asked our community, have you experienced postpartum depression? She says twice, and she wrote about it. I want to pull up that headline here, the headline, my postpartum depression did not make me a bad mom. And she goes on to say that 3 years ago, she became a mother for the first time. And in the beginning, it was uncomplicated, it was beautiful. And it was the following 6 weeks that weren't as magical as those first few moments. Indeed, they were more akin to torture. Carly, what was that exact moment for you when it felt like torture?
I think torture, I think when day 5, when I got home from the hospital, was when, all the help was gone, and was when I realized that something was off, that I felt extra bad. But I think when it became torture was about 4 months in, when I had one of the symptoms which the doctors described, which was hypersomnia. All I wanted to do was sleep. Definitely, I was acting like a different person, and it wasn't getting through the day that was difficult. It was getting through moments in the day, and I think that was when it became what you would call torture, because every minute was difficult to get through. But I want to touch on real quick 3 things that the doctor said that were really important. One is that the difference between the baby blues and postpartum depression. I think a lot of moms told me, oh yeah, it's normal. I felt sad too. And I think they were referring to the baby blues, which wasn't what I had. And so I was kind of in this gray area where I wasn't sure whether it was normal or not. And of course, because I was embarrassed to talk about it, I wasn't really able to articulate what I was feeling. And a lot of people were telling me, yeah, it's normal to feel sad. And so that's an important point. There is a difference. A second thing is it's kind of moving to hear the doctors talk about the symptoms like this. I wish I would have had that experience of someone being able to tell me, these things you're experiencing are postpartum depression, So it's moving to hear, and we need more medical professionals who can know the signs, memorize, know the signs.
Can I ask you, Carly, so when you were experiencing postpartum depression, did you know what it was, and did you talk to your physician and or midwife, and what was their response? That tends to be a problem a lot of the time.
Well, by month 4, I realized it wasn't normal. It was getting more and more difficult. I spoke to my OBGYN, and she told me that me personally, I probably needed a change in lifestyle. I didn't need medication. I needed to incorporate daily exercise, preferably in the morning, maybe meditation, breathing control, doing something positive for myself every day. But at that point, I was getting more and more depressed, and the idea of incorporating exercise into my day when I was barely able to shower with a 4-month-old baby who had reflux and who wasn't sleeping, it was just kind of hard to conceptualize.
Yeah.
So
It's
I did
unrealistic.
speak with my yeah, it was unrealistic at the moment, and that's where things started to take a more negative turn for me, because then I was referred to a psychiatrist, but we can get to that later.
I want to show this
You know,
to you.
it's funny.
Yes, go ahead, Dr. J.
sorry.
Go ahead, Dr. J.
No, I was just going to say, I was just going to say that I think that the setup for postpartum depression starts right after delivery. And this is something I've always been very sensitive to. We'll deliver parents, C-section, vaginal delivery, and immediately that baby is out, and all of the attention that was on mom goes with baby. And literally, oftentimes mom is there by herself while we're doing our repair or whatever the case may be. And so I'll talk to them and I'll say, how are you feeling? And I'll joke around and I'll say, get used to it. But this is kind of what it's like. Everybody's focusing on the baby now. But one major thing that partners, family members could do is remember there are, for lack of better terms, we're looking at it as physicians, but two patients. There's a mom and there's a baby. And giving the baby a lot of attention is important, but giving mom attention is important too. And I think as soon as the baby's out, people forget that.
Dr. J, you were reading my mind. This is what I was going to share with you from Men's Health. Everything dads need to know about postpartum depression. I think this article probably overpromises a lot, because I don't think you can say everything that your dad needs to know. But your spouse or your partner, Carly, from your experience, what would you suggest that other person in your life, the family support system, what do they need to know about you?
Well, I think this is my perspective as a woman, and from women I've spoken to, but a lot of women I know who I've spoken to about postpartum depression said that the men in their lives felt they couldn't handle the topic because they felt like a failure personally. They took it personal. So I think a lot of the partner, regardless of the couple, the makeup of the couple, needs to understand that if the mother has postpartum depression, it's not your fault and you're not a failure as the partner. But you do need to be supportive. You do need to know to ask the right questions. And also, another point that's related to what the doctor said and what you just said is, like, one of my favorite authors, Chimamanda Ngozi Adichie, says, dad is as much of a verb as mom is, and so dads need to be just as involved. And if you know that your partner has postpartum depression, or maybe they're just getting used to it and they don't have postpartum depression, but it's just a new baby, you need to help out. You need to help out.
I think that
Dad
is so
just
huge.
as much of a verb as a mom.
No, absolutely right. I think that is a big part. I tell my moms, because I'm definitely going to see the moms both before, deliver, and after. Sometimes I see the dads as well. But having 5 children myself, I know that it's kind of a learning curve. And I think a big reason why postpartum depression is so prevalent is because the majority of the job of parenting, especially when babies are babies, is on mom. And so I tell all of my dads, like, obviously you can't breastfeed, there's certain things you can't do, but you can get up, bring baby to mom when she's going to breastfeed. You can do more of the diaper changes. You have to be more involved, because a big reason why women have postpartum depression is, for lack of a better term, they feel trapped. You have this baby who is totally dependent on you, and you feel like you have no help. And not only that, but if you have other children, sometimes dad is not only not helping, but he still expects you to be superwoman. He wants dinner on the table, or he wants you to go work after 6 weeks. And so that is a huge part of it. And another thing that she touched on, I think that a lot of people don't recognize postpartum depression because a lot of times, and I'm talking partners, a lot of times it's not obviously depression. One of the biggest signs is actually anger. Like, you'll feel like, oh, she's just angry. Oh my gosh, she's angry again. Hormonal, exactly. And so they're on the defensive. They feel like, oh my God, what is it I'm doing? What's wrong with her? And so they miss that sign. So dads, partners have to be very in tune to any personality changes.
See,
potentially being a sign of
Dr. J,
depression.
you're giving us really amazing advice, okay? But give us something practical that dads can be doing. So they have their partner who's exhausted and experiencing postpartum depression. What can the dad actually do?
It is the small things. It's the small things. Like I said, it's getting up and changing those diapers. It's, maybe making sure that she doesn't have to cook dinner if that's what she does for the next, 4 weeks, 8 weeks, whatever the case may be. Just the little things. I mean, there's certain things that dads can't do, but it's just those little things. I kind of joke with my patients and their partners, but I'm like, I know you're not blind. You see all the stuff she's doing, so just get up and help. There's not.
And I was just going to say, one simple thing is breastfeeding is super important, and we really encourage it. But when we encourage breastfeeding, you are putting basically all of the feeding responsibilities on mom. And so one thing that I encourage people to do is pump, and then put it in bottles, And then dad can feed the baby as often as mom can feed the baby. Baby's still getting the benefit of the nutrients from the breast
Don't
milk.
do that too much. Nipple confusion.
Well,
that's another topic, no show.
But honestly, that's one thing that can help, because when you talk to most moms, it's being up every 2 and 3 hours. And it's not that you just get up and feed. You get up and you're holding that baby for 30, 40 minutes. It's exhausting.
And
so
then by
that's one
default,
big thing.
you change the diaper because you're already up, and so dad ends up sleeping the night. So I think the biggest part, or one of the biggest parts of postpartum depression, is sleeplessness. So one thing that I did with my fifth one, I'm not going to claim that I was the best with the other four, but with the fifth one, we actually alternated nights. So she did Monday, I did Tuesday, she did Wednesday, I did Thursday, and I was pretty exhausted. So I can kind of see, why some people do become depressed. So I think just doing your part is huge.
So, Dr. J, Dr. I, we've got partners covered. We've talked about what the husband or what the partner can do. There's also a suggestion from people online on what medical professionals should be doing. So this is Truth Seeker, who says another way to prevent postpartum depression is to have nurses assess the risk of it before it happens. Having postpartum complications, having a first child, being stressed, being a single parent, being a new immigrant, being poor are all things that can increase the risk of PPD. So when we're talking about nurses, we also got a video comment from a nurse who would agree with that statement. This is Colette, and this is what she told the stream.
As nurses, we can try to make sure that when we assess our patient, that we are able to find out if they have support and what is that support that they may have. We also need to make sure that the care that we give them are culturally sensitive in a language that they can understand. And the teaching that is done need to be done in a culturally sensitive way.
So Carly, hearing what Colette had to say, do you think your nurses and your medical professionals did that for you? How long did you stay in the hospital afterwards, and did you have that care?
I was in the hospital for 4 days. I actually had complications in my C-section, so I had a really difficult surgery. I think my nurses and my doctor were a bit more concerned about my physical health than my mental health, which was, in retrospect, not good for me in the long term. I think also, I remember reading an article about a woman who got postpartum depression living as, in another country, and she was living in Malaysia or Singapore, I believe, and she mentioned that she didn't know what resources to look for in that country because it wasn't in her language and it wasn't her country. And I think that's an important point to consider is for me, for example, even though I speak Spanish, I didn't know what resources really were available to me in Mexico. And I think that's something that a lot of people face when it's not their native country, even if you speak the language.
Carly, I'm just looking at some pictures you sent us of your lovely little ones here. And can you talk us through who we have here? So
that's Emiliana. She's 2.5 now.
Okay. And
that's Emiliana still. That's Emiliana and Ines. That's my 8-month-old and my 2.5-year-old.
So during this whole process of you getting better, how were you with your little ones?
So to be honest, it took me about 1.5 years to really get out of it, I would say. And like I mentioned earlier, during the depression, it was just trying to get through moments, half-hour periods. My whole day revolved around making sure my kids slept so that I could take a shower, so that I could do things around the house that I needed to. With my second daughter, it didn't happen. I didn't get postpartum depression. I was really, really worried that it was going to happen. And I wonder, the doctors can again probably answer this better, but with your second child, are you less likely to have postpartum depression? Because at least for me, at least I knew what I was doing. I knew what to expect. The crying didn't stress me out as much. And there's a really important point that came to mind that I'd like to make. I remember in my pregnancy reading really early on that if you were getting really stressed out, if you were having anxiety with your new baby at home, to put the baby in a safe place like the crib with no blankets or pillows or toys that could suffocate them, and to go take a shower. And that was something that I did religiously. And even though my daughter would be crying for 10 minutes, I mean, it's not going to actually affect her health to cry as long as she's in a safe place. And that time allowed me to kind of process my feelings, do deep breathing in the shower, and get through the moment, come back and be able to take care of my kid. And I think actually now, when I see her and she's able to play by herself so well, in comparison with some of the other kids I see her age. And I think maybe that started then, when I had to leave her to be able to go take care of myself. And yeah, it was hard to hear her cry for 10 minutes in the shower, but I needed it. And it allowed me to go back to her and be a better mom.
Carly, I love that you shared that.
All joking aside, though.
Dr. I and Dr. J, I actually want to direct this to you, and I want to hear what you have to say, but I love that she shared that tip, because this is comments that we're getting live here on YouTube, and I want to share them because I'm hoping you can help. So Sam Hart says, my depression started from my traumatic childbirth. I couldn't express how traumatic it was for me, and I feel guilty for feeling that. Another person on YouTube just writes in May. She says, I have been depressed for a while after giving birth. So keeping in mind Carly's suggestion and what worked for her, Dr. I, Dr. J, what would you tell these people who are watching this show and don't know where to turn?
Well, so it depends locally where you are in terms of what resources are available. But the first place you always want to turn, other than to family, is to your healthcare provider, because they're going to know the best resources available to you where you are. But I think one thing that one viewer said that's really important is, and I tell my patients this all of the time, I say pregnancy, childbirth, being a parent is a beautiful experience, but you have to realize it's also extremely, extremely tough, and have very few expectations about what the experience will be like. Because people think I'm going to go into birth or into labor, it's going to be a great experience, and I tell them a lot of times it's not. And so have expectations, but be prepared for the disappointment that comes along with failed expectations.
How do you tell a mum who's about to give birth, this experience may not be a good one? How do you do that? What's your bedside manner? Because I would run screaming to the hills.
Well, so this is what I do. I tell them, I say, look at me, I'm an OBGYN. I say my wife is a labor and delivery nurse, and we had expectations of what it was going to be like, and we knew better, and it went completely the opposite. But because we knew that it could, we weren't as disappointed, and we got past it. And so I kind of use that personal example. I say it's okay to have expectations. We had them. It doesn't always work out, and be prepared for that.
And that's the thing. People that have, traumatic deliveries, if you have a C-section or if there's an emergency of some sort, they're more prone to developing postpartum depression. But one thing one resource I want to give people that's a little bit more concrete. There are 3 places you can get information about postpartum depression. One is called ACOG, the American College of OB-GYN. They've got a lot of information that's more U.S.-based. There's RCOG, which is the Royal College of Obstetricians and Gynecologists. They're in Britain, but again, they have more international material as well. And then FIGO, the Federation of International Gynecologists and Obstetricians. All of them have information on what postpartum depression is, how to recognize it in partners, and things that you can do to treat it. Self-care, like Carla was talking about, is actually a huge one, but it's usually self-care, talk therapy, and sometimes medications. I know Carla said her doctor put her on antidepressants. Unfortunately, a lot of physicians, that's a quick, easy fix. Let me write a prescription. I've got 5 other patients to see. Get on out of here, And while antidepressants play a role, talk therapy actually tends to be more important because, again, moms feel incredibly guilty and ashamed of the fact that they are experiencing what they're experiencing. And so being able to express that and get that positive feedback is usually helpful. But self-care, medication sometimes, talk therapy, those are huge.
Here's one other tip from Swarnima. She sent us a video comment. She's the founder of Women's Healthline, and this is what she told us.
In South Asia and particularly in Indian culture, motherhood is considered very sacred. It is pedestalized, and as soon as a woman becomes a mother, she ceases to be a woman in her own right, and therefore she does not have the right to complain, to say she's feeling blue, to say that she needs some time for herself, and therefore postpartum depression and its symptoms often get ignored. And as a women's health organization, we talk to many women who claim that they have had postpartum depression in the past, but their narratives just remain hidden because we don't have a culture where women can talk about themselves after motherhood as women and not as mothers.
So Carly, we have just about 45 seconds left. Talk. Seems to be her suggestion. What do you make of it?
Well, I think the point that she makes about women ceasing to be themselves is really important. I think, in fact, part of postpartum depression is this identity crisis where you go from literally one day to the next as a complete individual, and the next day you are someone else completely attached to you, like another limb, and everyone expects you to do nothing but live for this other being, but you still exist as a person. You existed yesterday as a person, and people need to realize that. And people need to respect it.
Carly Pearson, Dr. J, Dr. I, thank you for being part of our show today. Really helpful advice. Let's end on this picture of Carly and Emiliana and Ines, because there is light at the end of the tunnel. And for international advice and some of the resources that Dr. I and Dr. J actually mentioned, we will be sure to tweet them out for you. So look out for at AJ Stream. Follow our Twitter feed and we will put that information out there for you. From Malika and I, we will see you online. #AJ Stream. See you soon. Thanks for watching.